Topic name: acute diarrhea. We know that most of the acute diarrheas are infectious in nature, and 10%, around 10% are caused by medications, toxic ingestions, ischemia, food indiscretions, and other conditions. Our gut contains this microflora, but they are of different species. They play a role in suppressing the growth of ingested pathogens, but sometimes we use antibiotics that can lead to diarrhea by allowing the overgrowth of pathogens, for example C. diff. And note that in SARS-CoV and Legionella, diarrhea occasionally is an early symptom of infection. Now, pathophysiology is important. Note that profuse watery diarrhea, which is hypersecretion that's occurring in the small bowel. It occurs with ingestion of toxins which are preformed or enteroadherent pathogens. Note that when a person develops diarrhea and marked vomiting is there with minimal or no fever, then it's usually toxin mediated, and usually the toxin is named as enterotoxin. So in that case there will be no fever or minimal fever, and it will occur within hours after ingestion of the food that will be containing this enterotoxin. Whereas in the later part, which is enteroadherent pathogen induced diarrhea, usually we see the vomiting part is less. There will be diarrhea, but vomiting part is less, but at the same time abdominal cramping or bloating will be much more there, and fever will be high. So in enteroadherent pathogen, diarrhea will be there will be high fever will be there, but there will be less vomiting. And note that cytotoxin producing invasive organisms can cause very high fever and abdominal pain. Invasive bacteria and Amoeba histolytica can cause dysentery. Note that Yersinia has multiple manifestations. Yersinia can cause mucosal injury in the terminal ileum and proximal colon. Also, it can cause this right iliac fossa pain due to this involvement of terminal ileum and proximal colon, leading to, or it can mimic this appendicitis. So this pseudoappendicitis. And also we know that this Reiter syndrome is something which is also called a reactive arthritis, and where there is arthritis, urethritis and conjunctivitis, it may occur or it may accompany Salmonella, Shigella, Yersinia or Campylobacter infection. So Reiter's syndrome can occur in such conditions. Also, Yersiniosis may cause autoimmune thyroiditis, pericarditis or glomerulonephritis. And it has been seen there is an entity called as post-infectious IBS which develops after infectious diarrhea. And note that acute diarrhea can be a manifestation of systemic illness like viral hepatitis, listeriosis, legionellosis and toxic shock syndrome. So if a patient has developed toxic shock syndrome and now develops diarrhea, the source cannot be gut. The source is the pus that's coming out from the ulcer which has led to this toxic shock syndrome. So this is a consequence, not the cause. And also this acute gastroenteritis, it may precede the diagnosis of celiac and Crohn's disease. Other causes like medication induced, we know among them is antibiotics. We all know that cardiac antidysrhythmias, antihypertensives or NSAID intakes, even certain antidepressants and bronchodilators which we use which we often use in cases of these obstructive airway disease. And there is this entity called occlusive or non-occlusive ischemic colitis, which usually occur in patients greater than 50 years of age. And how will they present? They will present as first they will develop this pain abdomen, that too in the lower quadrant, here either in this quadrant or either in this quadrant, but it will be lower abdominal, and there will be then watery diarrhea that will it will be followed by then bloody diarrhea. And how on sigmoidoscopy or in colonoscopy, what we will see, there will be acute inflammatory changes in sigmoid or left colon, where it will be sparing the rectum. Also, diverticulitis is a diagnosis if pain is on the left side and patient has developed diarrheal episodes. And certain poisons like organophosphorus compounds, mushroom, amanita, arsenics, and excess of histamine due to inadequate refrigeration. Now, what are the indications for evaluation when a patient develops profuse diarrhea with dehydration? And these are gross bloody stools and fever is greater than 101, that too for greater than 48 hours after evaluation, and patient there is no improvement. So fever remaining greater than 101 degree Fahrenheit for more than 2 days without improvement, and there is recent antibiotic use, or there is new community outbreak, and there is severe abdominal pain in patients greater than 50 years of age or greater than or equal to 70 years of age, or there is this immunocompromised patients. What is called protectin? It is a leukocyte protein. So you have to send stool examination. You can do immunoassays for certain toxins like C. diff toxin. You have to send stool for immunoassay for this toxin. Also antigen detection like that of rotavirus, or protozoal antigen detection like that of Giardia and Hemogua histolytica.